Hi guys! In this video I'm going to discuss high volume injections for Achilles tendinopathy and whether they're useful to have or not. What we're going to look at is how high volume injections are meant to work and what they do when they actually do the injection for you, and then also have a look at the latest research and see if the evidence is there that it's a useful procedure to have and when to have it. My name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want to know more. So I also have to apologize if you're hearing a lot of banging in the background, but we've got builders next door and I can't do anything about it today. So let's move right on. How do high volume injections work? So they are mostly used to decrease pain so that patients can get on with rehab. Now, often patients feel that they shouldn't decrease pain because it's a warning signal and they're worried they'll injure themselves more. But we know from the research that pain does not equal severity of injury. And sometimes pain can be totally disproportionate to the injury you have. So it's okay to decrease pain to allow you to get on with a progressive rehab program. It's not okay to decrease pain and then you go do high impact activities if you've not built up to it. So it's all about how you use that. So it's always, these injections are always used in conjunction with a strength training program, because the injection is not a magic fix. What it does is it just brings your pain levels down that you can actually get on with a rehab that will strengthen your tendon back up and get you back to running or whatever sport you prefer. Now, what do they do during the injection? They inject a large volume, usually about 50 mils if I'm correct, of sterile fluid, saline, normal saline. So there's no magic in that, it's just the volume of fluid. They combine it with a little bit of anesthetic to help with pain after the injection, so you don't feel it much when they do it. And they also sometimes put a little bit of corticosteroid in there, and other times they don't. How's it meant to work? There are three theories around it. One is that it's the local effect of the high volume of fluid. So they usually aim the injection, and this I should also say is these injections should be done under ultrasound guidance, because you have to see when you inject, because you've got to inject it towards the area with the most tendinopathy and where you can see the little blood vessels grow in. Healthy tendons don't have blood vessels growing into them. That's a sign of a tendinopathy. Now these blood vessels have little nerves growing along them, and one school of thought is that the pain you feel when you have Achilles tendinopathy is partly due to that little nerve that's growing into the tendon. So this high volume of fluid is thought to then squash the little blood vessels, which makes them disappear, and then that also gets rid of that little nerve, and that's why your pain decreases. Second school of thought is that it's actually just a local effect of the steroid that's being injected, because we know steroids are very good at killing pain in the short term. But there are research studies where they looked at what happens if you leave the steroid component out. So they looked at high volume injections with a little bit of steroid, without a bit of steroid, and they found that actually both conditions improved at the same level. So it's likely not the effect of the steroid. But then a third reason why it may be getting better, which nobody has investigated so far, is the effect of that anesthetic that they include in the injection. So we know with injuries that's been going on for more than 3 months or longer, that the body's pain system can become oversensitive and overactive, and it can create a lot more pain than what you should have. So it may be that this anesthetic just calms down that pain system and resets it so that you actually feel the level of pain you should be feeling. So that is definitely something that they need to be investigating, because if that's the case, they can do an injection that's much less disruptive still. What does the research show? Does it actually work? Well, there's really not a lot of studies out there yet that's investigated this properly. But the research that is out there does seem promising that it does have a good effect on pain, and it can be an adjunct to rehab. So let me just quickly, yes, so the important thing here is to remember that these injections are mainly used to allow people to get on with their function, so to decrease pain. So you have to combine it with a structured rehab program, because the injection itself is not going to make the tendons strong. You have to use the rehab to get the tendons strong. But it's definitely an injection that I would consider in patients where pain is preventing them from getting on with their rehab. So let me know if you've got any questions. If you need more help with your injury, you're always welcome to consult us via video call. Link to the website is in this description of the video. Take care.